Similar to what we saw with Texas, California is now going to stop posting weekly COVID hospitalization data before the end of April. As a reminder, with the end of the public health emergency declared last May, hospitals would only be required to continue reporting on COVID hospital admissions up until the end of April, and it was written in a way where it could be ended sooner. We saw that Texas first took the opportunity to end sooner, and California is now following the lead. And as a result of this, COVID new hospital admissions, which is a key indicator of severe COVID disease in the community, again, a lagging indicator, but still an indicator. This will no longer appear on the state's respiratory virus dashboard, which provides weekly updates on new hospital admissions for COVID and the flu, which is interesting because in theory they would still be reporting on flu hospitalizations. So I don't know why they wouldn't just continue reporting on COVID hospitalizations. At this time, California will continue to track COVID test positivity and deaths. However, recall that test positivity is way parsed down. They don't include rapid antigen testing, and due to the cost of tests, we're pretty much only getting test positivity on severe hospitalized COVID patients. Where the emphasis from the state epidemiologist, Dr. Erica Pan, is that at least in the short term, these two data points will continue, which is not a promising phrase. For the time being, the state will still maintain wastewater surveillance to track COVID trends, and apparently we'll have an update on how respiratory surveillance will be tracked in the next season. I'm assuming they mean in the winter. At this time, as I mentioned prior, it's not clear whether after April 30th, California will monitor COVID hospitalizations the way it monitors flu hospitalizations, which is to collect data from some but not all hospitals in the state through its decades-old surveillance network known as Sentinel. And as I have been thoroughly documenting, we no longer, quote unquote, have the tools, as this is one of the last few data points left standing that people can use to judge not only how society is doing, but how they should be protecting themselves at an individual risk level. Where the most important point is that hospitals are stretched so thin that most probably would not continue reporting the data if it's not mandatory.